Welcome to today's webinar. We are excited to have this conversation with you about the college's new resource, Culture, Equity, and Justice in Occupational Therapy Practice. My name is Diane C., and I'm a practice consultant here at the college. We will spend the next 30 minutes going over information on our slides and then spend the last 15 minutes answering the questions we received before the webinar. Note that all of these questions and answers are being posted along with the recording of this webinar on our website. For today's presentation, I will be presenting with two other speakers, Sandra and Sophie. Each of us will introduce ourselves as we move through the presentation. First, we would like to begin our webinar with the college's land acknowledgement. We recognize that we work and live on traditional lands and territories of Indigenous peoples. This includes the traditional territories of the Mississauga, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today, the province of Ontario is home to many diverse First Nations, Inuit, and Métis peoples, from the Cree in the northern reaches to the Delaware in the south. We acknowledge that we are tasked with sharing, respecting, and valuing the land as a source of life for us all. We encourage all participants of this webinar to reflect on their own location, the land they live and work on. But beyond just reflection, it is important that as healthcare professionals that we seek to understand the ongoing impact of colonization on Indigenous people and the deep history of wrongful treatment of them in a country we all call home. Before we dive into the material, I would like to take a moment to acknowledge the many people that contributed to the resources we will be discussing today. The college does not develop resources in isolation from those we are accountable to. Our work involves registrants, the public we serve, those on committees, and the board, and in this case, occupational therapy students. We aim to include a breadth of opinions from all of those who will use our resources to guide their practice, to inform decisions, and to educate or learn. We thank all of you on this call who contributed to the development of this material in one way or another, and for showing up today to engage with us, so together we can drive positive change for the people we all serve. The goal of today, and really of the materials that we will be discussing, is to start having conversations with registrants about how they can either start or continue to incorporate the important principles of culture, equity, and justice into their practice. The recently launched Competencies for Practice have new levels of expectation and accountability for Domain C, Culture, Equity, and Justice. Through this webinar, we want to orient registrants on the competencies and the resources we develop to accompany them. As the college, we will stay within our mandate of public protection, recognizing that more fulsome education on these topics is available through other opportunities. Therefore, today is not as much about education as it is about awareness. The survey we conducted with registrants told us that registrants are at different stages in their learning. We expect that everyone will experience these materials and even this webinar in their own way. For some of you, this work has been part of your practice for years, but for many it is new. We know that these conversations are not always easy, and admitting our own gaps can be difficult. It requires both discomfort and bravery, but right now the expectation is that occupational therapists arrive to the conversations, reflect on their own bias and privilege, and work to reduce injustices that they encounter in their roles. As a college and as people, we know that we are not perfect. This work is also not perfect. This work will evolve. Today, we would like to create openness and to spark reflection. If we do that, we are continuing to play our own part in moving these conversations forward. The secondary goal is to encourage questions and feedback. Your questions often signify the gaps in our resources, so please feel comfortable asking us about and challenging us on what has been created. We want to highlight and recognize that it is not the responsibility of OTs with lived or living experience to educate others on how to get this right. This responsibility falls to us all. I am now going to ask Sandra to continue this conversation.
My name is Sandra Carter. I've been an OT for 25 years and very recently moved into the position as manager of practice. I hail from a strong Caribbean British heritage where my family placed great value on education. I identify as a Black female, able-bodied, and an occupational therapist practitioner. I've experienced firsthand the impact of systemic racism. I now listen to learn rather than listen to speak. And with that being said, why did we develop these resources? Well, in 2020, the college updated their values to reflect our commitment to treat everyone with dignity and respect and support efforts towards equity, diversity, and inclusion. And prior to that, the college was involved in the development of the Competencies for Occupational Therapists in Canada as a collaboration with a tripart commitment between regulators across Canada, universities with OT programs, and the Canadian Association of Occupational Therapists. As you know, the competencies were launched in October of 2021 and included a domain that addressed culture, equity, and justice, which was absent from the 2011 essential competencies. As well, shifting societal expectations resulting from the Truth and Reconciliation Report and other high-profile public events highlighting racialized, systemic, gender, and other discriminations have demanded that those in professional roles, the public, and healthcare professionals start to reflect on, understand, and work towards the correction of the injustices, oppression, racism, discrimination that continues to plague many people in our society. When we started this work, we needed not only to look inward, but also look back at the history and the evolution of occupational therapy as a profession. According to the Journal of Occupational Therapy Education, the OT professional identity that was formed from traditional medical models, white Western ideologies. As well, in 2019, the World Federation of Occupational Therapists made a call to action for the profession to combat systemic racism and called on its member organizations, for which Canada is part of, occupational therapists, occupational therapy assistants, and students to support and advocate for occupational justice and human rights. We have learned both through research and conversations with others that the principles of equity and justice are not always easily operationalized within OT practice. The CEJ resource is a starting point in the call for action to lead change in culture, equity, and justice for all people, communities, and society receiving occupational therapy services. Next slide, please. So we started to identify the need by reaching out to our registrants, regulators, associations, and universities. We surveyed and involved OT students in an evidence-based project and placement to help us build the content. We connected with registrants through our equity and Indigenous panels, used the Citizens Advisory Group. These are individual patients or caregivers who are recipients of healthcare services for feedback. We also worked with our practice subcommittee, executive, and the board to obtain additional registrant input and public. Next slide, please. So Domain C on culture, equity, and justice from the National Competencies is incorporated into our CEJ resource. Domain C speaks to OTs promoting equity in practice, anti-oppressive behavior, and culturally safer, inclusive relationships, and also how OTs can contribute to equitable access to occupational participation and occupational therapy. I will now turn it over to Diane, who will walk you through the new CEJ resource.
Thank you, Sandra. I'd like to take a moment to just introduce myself.
My name is Diane C., and I go by the pronouns she, her. I am an occupational therapist who, before joining the college as a practice consultant, had a 20-year career working in both hospital and home and community care sectors. I've had the privilege of working with people of great diversity in the urban areas surrounding Toronto. I am the daughter of immigrant parents from China who came to this country with very little resources. But despite my family's humble beginnings in this country, I now hold a position of great privilege, being first-generation Canadian, raised and educated in this country, and working in a profession that I love. Being an OT of Chinese descent, I have had to reflect on the lens in which I view my clients, as well as reflect on some of the assumptions that have been made about me over the years on the job. I continue to reflect and learn about how my social position affects all the work that I do. So getting back to the topic at hand, as a complement to these new competencies that Sandra just described, the college created a new resource. The new Culture, Equity, and Justice resource serves to outline the expectations for how OTs can provide services that are culturally safer while upholding the human rights of all clients. And this includes all the people that OTs come across and work with. The document is intended to be a starting point to help all occupational therapists to best apply the principles of culture, equity, and justice in practice. These expectations apply regardless of practice area, practice setting, job title, whether you're clinical or non-clinical. Next slide, please. Depending on your style, there are two ways for you to access these materials and enable you to go back in order to reflect on the information over time. You can download the entire PDF document in English or French and have all the information in one place. Or if you're like me and you like your information grouped in smaller chunks where you can click back and forth to read and reread certain sections, then you can go through the web pages. Both methods are available through the Kodo website. A shortcut link is also provided here as well. Next slide, please. I won't present all the details of the information, as hopefully you will all go over all of this on your own time and at your own pace. But I will provide an overview of how the materials are organized to hopefully make your review easier. The document first starts with explaining the concept of intersectionality. This provides the backdrop and foundation to understanding the concepts in the rest of the document, and we will talk a bit more about intersectionality later. The next section is simply titled, What Occupational Therapists Need to Know, and explains 5 key concepts, namely about systemic oppression, bias, the terms available versus accessible, trauma, and that OTs also have human rights. Some of these concepts and language may be new to you, as they were to me, and that's okay. To help make sense of the new language, there is a glossary with practice examples in Appendix A. So whether you like to flip back and forth between the two sections or read it all in sequential order, the materials are designed to work together for you. Next slide, please. After familiarizing with what OTs need to know, the next section focuses on what OTs can do. Again, I won't describe each of these in detail, but as you review this on your own, the main idea is to approach it with openness, reflection, and flexibility. The concepts of critical reflexivity and relational accountability is further explained in the glossary. So again, you may wish to refer back to Appendix A as you review, and Appendix B provides a variety of reflective questions as OTs begin that process of examining their own practice. We recognize that it can be difficult to reflect and question one's own personal and professional views. A list of references and resources is provided at the end of the document, and we will talk more about resources again later in the webinar. Next slide, please. So to support OTs in their learning journey, there are additional supports for you to look out for. First, the PrEP module that will be coming out later this year will focus on the new national competencies with a 60% focus on culture, equity, and justice. You can also tap into the resources that we just talked about that are listed in the document. The standards for practice have just been updated to incorporate the new competencies and information about culture, equity, and justice. These updated and streamlined standards for practice will be out soon for public consultation. So please stay tuned for your opportunity to review these and provide feedback. Lastly, the practice resource team is also here to help answer any questions you have on this and other practice inquiries via phone or email. Next slide. Thank you. Since its release in February, we know that hundreds of people have looked at the material. We have received feedback mostly from OTs in Ontario, and it has largely been positive, with respondents rating the overall document as good or excellent. You can also see some of the comments we received on the slide, which have also been mostly positive, with one comment about the material being divisive. We are mindful that work like this can result in that type of reaction, so we will consider all the responses and feedback that comes in and monitor the need to adjust the content over time. Generally, the respondents appreciated the reflection questions and the practice examples. We've been engaged by other regulators for our expertise and leadership on this topic. Other regulatory bodies who are not as far ahead in this area are looking at our materials and asking us about what we've done so far. We continue to welcome your feedback. We encourage registrants to connect with us and share your thoughts and comments. The Culture, Equity, Justice materials can be found on the CODA website under the Standards and Resources tab. The link to complete the feedback survey is also located with these resources throughout the web pages. We also invite you to contact our practice resource team with any questions or concerns. I will now pass the conversation on to Sophie.
Thanks, Diane. Before I continue with the next section, I want to take a moment to introduce myself to give you an idea of the lenses through which I view this work. My name is Sophie, and my pronouns are she and her. I am an occupational therapist and child and youth mental health counselor practicing on lands that have been and continue to be cared for by Anishinaabe and Métis peoples in what is also known as the Treaty 3 area or Northwestern Ontario. I am a recent grad of McMaster University, and I became involved in this work through a project with 3 of my student colleagues, Eden, Katie, and Victoria. Victoria and I also completed a clinical placement with the college to continue this work, and at the end of the placement, I wasn't quite ready to let it go. It was important for me to see this project through to completion for a few reasons. Partly because I feel very connected to this work in my heart, and also because I wanted to practice accountability. This work is not perfect, and I know that despite best intentions, there is potential to cause unintentional harm, and I want to be able to own my part in that. So that said, I was very fortunate to continue to do some consulting work on this project. And speaking of fortune and privilege, I think it's important for me to acknowledge the great privilege that I hold as a white, heterosexual, cis woman of settler ancestry. I also bring the lens of someone who grew up in a working class family where there was lots of love, but not a ton of money. This work has also brought me face to face with my own internalized ableism, and I'm still trying to figure out where I fit within the disability community as someone who lives with a chronic condition. Like all of us, my identities and experiences influence the ways in which I show up to this work. And I think it's important to reiterate that the college understands that registrants are at different stages in their learning. Some registrants have been actively involved in this work for decades, whereas others are seeing this content for the first time. And in addition, registrants have various lived and living experiences that may impact their perspectives and experiences with these materials. That's one reason why we chose to use intersectionality as a guiding framework, to draw attention to the fact that both OTs and the people we work with have unique positions that are informed by the identities we hold and the experiences that we have in society as a result of these complex intersecting identities and the systemic contexts in which we live and work. On that note, over the next few slides, I'm going to attempt to address some of the common inquiries that we have received since these resources have been released. Next slide, please. We received some feedback about the complexity of language in these documents. This was an ongoing consideration as the document developed. We recognize the importance of accessibility and also acknowledge that it's very difficult to apply something that you don't fully understand. At the same time, we had to balance simplicity with nuance. These topics are complex and constantly evolving, and sometimes when we try to simplify language related to culture, equity, and justice, we actually change the meaning of what we are trying to convey. Language is a foundational component of this work, and I just want to provide some reassurance that we try to be very intentional with the language that we used. Next slide, please. If you are someone who is finding the content and language in these resources to be quite novel, I want to offer some validation. You have already taken an important first step by clicking on the link and taking a look at the resources. You recognize that there's more learning to do. And I think that's a commonality that we all share and something that we talk about a lot in occupational therapy, this idea of lifelong learning. So if you are someone who's looking at these resources and thinking, oh goodness, this is overwhelming, I want to encourage you to sit with that discomfort and acknowledge that there are gaps in your learning. Look through the content and the resources provided, identify those gaps, and have conversations with your colleagues. Work together to build common understandings. Next slide, please. There are two pertinent examples that came up in the questions we received that I want to address. For example, some people were asking about this idea of power imbalance and what does that look like in practice and how do we go about addressing it? And there's a simple way to look at that question, which is to say, well, occupational therapists as healthcare professionals are in inherent positions of power because we can make decisions that impact people's lives. For example, in acute care, OTs are often involved in decisions about discharge, including when and where a client may be discharged. In community care, OTs enter clients' personal private spaces, and they may also make decisions about whether or not it's safe for a client to remain in their home. There are also OTs working in non-clinical roles who hold positions of power. For example, OTs working in academia or teaching roles hold the power of knowledge and dissemination. They have some say in what is being communicated and how it's being communicated to students. Across nearly all settings, OTs hold power when it comes to funding and privacy. They're often required to submit reports or letters of recommendation, which may be used to determine the type and amount of services and/or equipment that a client receives. And regarding privacy, it is important to remember that because of the nature of our jobs, we almost always know more about our clients than they know about us. And that in itself certainly contributes to an imbalance of power. Now, things can get complicated when we start to consider our own identities and our clients' identities and our positions within broader organizations and systems. All of those things can shift power dynamics. So I think that's really something that we need to be aware of and reflect on in our everyday practice. Remember, it's not necessarily about eliminating the power imbalance, as that would be an impossible standard. Rather, it's about engaging in regular reflective practice to start to think about how you might go about redistributing and sharing power within your given context. Another question we got was, well, how do I create a culturally safer experience for my clients? It depends on where you work and the identities and social positions that you hold, as well as that of your clients. There will always be overarching practice and societal context that we need to consider too. So again, there's no one answer to that question, but I think it's something we encourage you to reflect on within yourself and your colleagues. And when we're talking about striving to create culturally safer experiences, it's important to remember that clients are experts in their own experiences and realities. So I would argue that co-creation, that is working in partnership with clients to build a therapeutic relationship or experience, is a good way to start to look at how you might foster safety. Next slide, please. And with that, we want to remind you that there is a document with reflective questions included with these materials. These questions are intended to be a tool to help uncover some of these nuances within your practice. There really aren't any right answers. The idea is to encourage you to start to bring awareness to these elements and maybe even challenge some of your own biases and beliefs you may hold consciously or unconsciously. There are also great discussion points to help you start having some of these conversations with those in your spheres of influence. It all comes back to that idea of lifelong learning and growing. I will now pass the discussion back to Sandra.
Thanks, Sophie. So addressing culture, equity, and justice at a practice level. So really what we're asking is occupational therapists to prioritize ways to deliver services that are culturally relevant, equitable, and just to their diverse populations. You may even say, how do I do that? Well, the college is not prescriptive, and we know that one size doesn't fit all. But here are a few basic suggestions. Be open and don't make assumptions. Understand what occupational participation and culturally safe means to you and the individuals you interact with. Culture goes far beyond a particular nation, people, or social group. Include questions in your interviews and assessments to elicit your patient or client's perceptions and beliefs. And examine the questions and comments that you will ask to ensure that they are relevant, necessary, and appropriate. Remember, mistakes will happen. We are all learning, unlearning, and relearning. You can explore supportive tools. The World Federation of Occupational Therapists has an advocacy toolkit, and so it's a great framework if you are looking into making macro or system changes. Working collaboratively with your clients to address their occupational context, and supporting your clients to participate in that shared decision-making and provide a platform for clients to share their lived experiences. Also acknowledging the social and psychological impact and internalized oppression that public policies and systemic racism may have impacted specific groups. Next slide, please. So where can you find more information? As was mentioned earlier, the Culture, Equity, Justice resource has a number of references and resources that you can tap into further. Connecting with your professional associations, for example, CAOT or OSOT have published many statements and future learning opportunities and best practice documents. Taking time to review those and taking what you feel is relevant for your client population or your practice setting. Engaging with your employer in their training and acknowledging your own privileges and biases and the lens that you come to the table with. Engaging in practice networks is an opportunity to collectively share and build the occupational therapy knowledge and work towards an anti-oppressive and accountable systems and practices. Also, take on opportunities to advocate, to be proactive instead of reactive. Even doing case analysis may be something that you can look into. Next slide, please. So here's the question for you. What is your call to action? Maybe it is as simple as adapting materials, consulting with clients or patients who are non-abled from Indigenous communities, LGBTQS+2, and other nationalities, to enable you to reflect on their cultural perspectives and preferences and engage with you while you are providing the occupational therapy services. Or perhaps maybe you're at the level where you can impact policies. You can always seek out provincial, federal, or municipal anti-discrimination materials and understand all applicable legislation, for example, AODA and the Human Rights Code. There are some self-reflective tools that many organizations are embarking on, and there are many, many workshops such as Equity Sequence that you can explore. Next slide, please. So I'd like to end with this appropriate quote. Each tiny effort builds on the next so that brick by brick, magnificent things can be created. We can start the call to action now. and we can start building together a strong profession seeking equity and justice to make a difference and protecting the clients we serve. In addressing culture, equity, and justice, as a regulator, we want to model the example. So we too are reflecting on our processes and policies and are holding ourselves accountable to this resource. We are learning, unlearning, and relearning. We will get things wrong, but we are committed to do the work and are trying to make it right. We know OTs and the public are expecting the same. So I will now turn it over to Diane to start us off with your submitted questions.
So thank you to those of you who have submitted questions to us ahead of this webinar. We will now take some time to try to answer as many of them as we can. One of the questions we received was, how do we incorporate principles of equity and justice into our practice and make changes within our workplace? That's a great question. It first starts with a commitment to move towards equity and justice. You can foster an environment where clients and colleagues feel valued, safe, and heard. You can demonstrate to clients and colleagues that you are seeking to understand and are approachable to conversations about this. Engage leadership in your workplaces to support inclusiveness at all levels. Educate others if you can, and consider forming committees to discuss and develop objectives. Set small measures of success and go from there. Thank you for that question. Hand it over to Sandra.
So the next question is, given the depth and complexity of the subject and applicability to occupational therapy practice, might there be future webinars or preps to offer more depth? And the answer to that is yes. The 2022 prep module will have culture, equity, and justice included. And so look out for that. It's coming soon. And yes, this is an ongoing process. As we learn more, we plan to develop accompanying resources and use the lens from different practice areas and settings, clinical and non-clinical experiences. We want to use the available resources that we have already embarked on, our equity and Indigenous panels, and engage other partners in other discussions. So I'll turn it over to you, Diane, for the next question.
So the next question is, how will the college support occupational therapists to see and address our privilege in relation to clients and being in a position of power? So the college will lead by example and be honest and transparent about the position of privilege that it is in. As the college, we will need to be open and even vulnerable when receiving constructive feedback and accept that we don't know it all. We don't have all the answers, but we are committed to listening and acting expeditiously to serve the public interest while keeping our positionality top of mind. And we hope that by doing this, we will help to model what OTs can start doing in their own practice. As we already mentioned, the PrEP module and the updated standards for practice are just some of the resources that we'll be rolling out soon to support you in this process. Over to you, Sandra.
Okay. The next question is, what kind of resources do you have for helping us think about culturally safer assessments? Well, that's a bit of a challenging question to respond to, but as a regulator, we hope that OTs are seeking out partners, resources, and literature, and networking with the associations to explore resources or best practice documents. I know if you go on OSOT or CAOT, they have a number of resources on their sites that have some research on assessments. Many organizations are starting to think about diversity, equity, and inclusion and culture, equity, justice. And the goal really is to, if there isn't a standardized assessment, that you're really just reflecting on your current practices and thinking about what changes can be implemented in the short term. It might be, again, as was mentioned in the webinar or during the webinar, on adjusting questions or what information you are obtaining from the client. You might even start with your documentation, making small changes of how you document your interactions with your clients or patients. And also thinking about the consent process and making sure that individuals have the information that they can understand, and then engaging clients in that co-creation and collaboration in decision making. And then again, we mentioned the World Federation of Occupational Therapists. They have a number of resources that you can access. They have an advocacy toolkit and an interactive forum where you can review and add your comments and build on your learning. Diane?
The next question is, how do we use justice in our occupational therapy practice? Well, it starts with returning to that core fundamental right of people to access equitable healthcare. And when we think about that, it can start us in the process of thinking about how to break down systemic barriers for our clients. Having an impact for our clients comes through knowing your client and understanding their experiences and background, being non-judgmental, and then using that to advocate on their behalf for what's fair. So justice is one of those things where it's a starting point when we're looking at our client and working with our client and thinking of this as a starting point for how we can incorporate it into our practice. Sandra?
What are culturally specific resources that we can provide to our clients? Well, here we rely on the OT's judgment. OTs work with a diverse and varied group of clients and patients. And so the OT can determine what the appropriate resources are available to provide to their clients. One of the things that we would encourage is that you consider the language of the material, alternate communication methods. Does the material contain offensive logos, biases, images that are not diverse, ableist language or assumptions? And also, we would encourage OTs to reach out to their community partners. Sometimes a lot of organizations have material that may benefit your diverse population, and it's a good opportunity to partner or network in if there are any other resources that can be provided to you or you can provide to them to give to their clients as they seek their support or services in the community. Diane?
The next question is, what is CODO's perspective on minimal standards for ensuring equity, inclusion, and justice within occupational therapy practice? The college expects all OTs to follow the Code of Ethics, the new essential competencies, and listening to your clients and taking your clients' concerns seriously. It's expected that you will take reasonable steps to incorporate these principles into your practice, starting at the granular level, to affect change that is within your setting and within your control. So again, we're talking about minimal expectations and a starting point. We recognize that large system changes will take more time. So start small and look at what you can reasonably do to start incorporating these principles into your practice. Andrew?
Okay, the next question is, how do we as OTs sensitively work with a culturally different client or patient population? That's a great question. And really, OTs are doing that on a daily basis. And OTs must be aware of their clients' socio-cultural factors such as race, ethnicity, customs, age, disability, gender, sexuality, and religion, and understand how those may affect your assessments, your interventions, your consultation, and your communication within the therapeutic relationship. And, we're asking you to look at what changes you can make on the cultural equity and justice level and avoid making assumptions, as we mentioned in the webinar. And just remembering that each client is unique and may have specific circumstances that need to be addressed or accommodated. And, through service provision and collaboration, allowing your clients to make informed choices based on unbiased and relevant information. Diane?
Next question is, what strategies pertaining to equity can be employed during virtual care? So some strategies are already inherent in OT practices, whether virtual or in person, such as looking at language and communication accommodations, or the use of informal supports to facilitate access to service. Specifically for virtual, it may require looking at options to accommodate clients who do not have access to electronic devices or even the internet. Sometimes it is the identifying and the pointing out of these issues to individuals or leaders who make decisions. Sometimes that's what's required, to look for solutions when it comes to promoting equity. Sandra?
All right. A few more, if we can get them through. What does the new domain of cultural equity and justice mean for the preparation of students and for student supervision? Well, we know that we're hoping the OT programs will promote reflection and equip students with the understanding that they come with privilege and will work with all clients of abilities and diverse backgrounds. The curriculum updates, our understanding is the curriculum updates are linking to the new national competencies, and other resource material may be coming forth in 2022 that will help students as they prepare to go out into the work environment.
Thanks, Sandra. I think that's all the time we have for questions, and so we will wrap up the webinar here. We would like to thank everyone for joining us today. A reminder that you can still provide feedback on the Culture, Equity, and Justice resource by completing the survey that is posted with the resource on the CODA website. A link is also provided here. We encourage everyone to follow us on social media. It's a great way to receive updates from the college. And of course, you can always reach out to the Practice Resource Service, which is Sandra and myself, if you have any further questions. We look forward to continuing these discussions with registrants. Thank you.